Ladies, listen up. Your emergency contraceptive pill can fail. Yes. And here are a few reasons why. Most emergency contraceptives in Ghana work primarily by delaying or preventing ovulation, especially the ones that contain levonorgestrel. They may also thicken cervical mucus to slow down the movement of sperms. Ovulation is a period in your menstrual cycle, usually in the middle of your cycle, where your ovary releases a matured egg into the fallopian tube for possible fertilization. Over there, the egg stays viable for 12 to 24 hours. In the same way, when intimacy occurs, the sperms introduced into the fallopian tube can also stay viable for 3 to 5 days. So this overlay is the window in which fertilization occurs. Now, emergency contraceptive pill can fail if 1. Wrong timing, or also known as the 72-hour misconception. Emergency contraceptives work best within the first 72 hours of taking it, which means that the earlier you take it, the more effective it is. Taking the pill later than 72 hours may lead to possible drug failure or possible pregnancy. The 72-hour window means 72 hours after unprotected sex, not 72 hours after the pill is taken. 2. If ovulation has already occurred. As mentioned earlier, the emergency contraceptive pill is supposed to delay or prevent ovulation from occurring. If ovulation has already occurred, the pill cannot stop fertilization or implantation, and it definitely does not affect existing pregnancies because it's not an abortifacient. 3. Vomiting within 2 hours or less after taking the drug. Vomiting can occur due to a physiological event or as a side effect of the drug. When this happens, it means that there's no proper absorption of the drug in the blood, and hence you may need to speak to your pharmacist or healthcare provider, who may recommend a repeated dose. 4. Body weight. For individuals who weigh 80 kg or 176 pounds and above, pharmacokinetic changes like increased volume of distribution may affect the concentration of drug in the blood. When this happens, the threshold needed to suppress LH surge may not be attained, and hence your drug may not work properly. For such individuals, it is recommended that they consider other options like the ulipristal acetate, which works better or is more effective in individuals with a higher BMI, or the copper IUD, which is not affected by weight at all. 5. Drugs. Certain drugs can interfere with the effectiveness or efficacy of the emergency contraceptives. Such drugs include drug inducers or antibiotics like rifampicin, anticonvulsants like carbamazepine, or antiretrovirals, and most importantly, some herbal medications. So the next time you go to the pharmacy to make a purchase, make sure that you are taking the drug correctly. However, you must know that even with all these precautions taken, emergency contraceptives do not guarantee 100% protection against pregnancy. The only method that is 100% is abstinence. Don't forget to share. You never know whom this might help. Remember, when in doubt, ask a pharmacist. Pharma e-Vend podcast, beyond the prescription.